Hi everybody. I think we're getting a quorum of people joining us this evening. I'd like to welcome you all to this online launch of the Introduction to Gender Responsive Health, and welcome to you all. We've got a great action-packed evening for the next hour, and we will be planning on finishing promptly at 8 o'clock. So thank you all for coming. First, I'd like to introduce myself as the MC for this evening. I'm Sally Moyle. I am an honorary associate professor at the Gender Institute at the ANU and the chair of the National Foundation for Australian Women, and a number of other things I might have run into people on around the traps. First of all, I would like to pay my respects to the traditional custodians of the land on which we meet around this country. I personally am joining from Narragaland outside Canberra. I'd like to pay respects to elders past and present and acknowledge the traditional folks who are meeting with us around this virtual table. A few housekeeping notes. We have Auslan interpreters, Leanne and Claire. They come from Sweeney Interpreting. If you would like to draw on their services in particular, you can spotlight them throughout the course of this, even when we're sharing the screen. So, and they will have their video on, of course, all throughout this session. So thank you to Leanne and Claire, and they will tell me if I speak too quickly, I know. So this is a webinar, so only the speakers will be visible this evening and able to go off mute. You can put questions into the Q&A if you would like. If there's any technical difficulties, please reach out to the team via that Q&A function. If you wish to access the live caption, you can do that from your own toolbar. If you're using social media and would like to use that, the hashtag that we're using is hashtag gender responsive health, all one word. So that's the introduction that I had. I also want to thank our colleagues at the Australian Women's Health Alliance, in particular Shanna and Yana, who have done so much work to get us here now. And thank you so much for inviting us all. So without any further ado, I'd like to pass over to Heidi La Paglia Reid, who is with us this evening. She's a board member of the Australian Women's Health Alliance and she's joining us from Le Troita in Hobart. She's a consultant and a disability and women's rights advocate with extensive personal experience navigating chronic health conditions and disability. Heidi's going to give us a few short introduction words about the course itself and about the Australian Women's Health Alliance. So thank you, Heidi.
Great, thank you, Sally. And hi, everyone. So as Sally said, my name is Heidi. I'm a board member of the Australian Women's Health Alliance, as well as a consultant and disability rights advocate, including in the area of women's health. I will first just acknowledge that I'm calling in from Muwinina country in Nipaluna, Hobart. I acknowledge that the land I live and work on belongs to the Muwinina and Palawa people, and that as a white person, I hold significant privilege that cannot be unlinked from my experiences. As a board member, as well as an autistic disabled woman and mum with multiple chronic illnesses, I could not be more pleased to welcome you today to the Alliance's launch of our module on gender responsive health. As someone that has been navigating health and medical systems regularly since I was about 15 years old, I know firsthand how being a woman and being disabled can be detrimental to the experience of accessing healthcare. One key example of this I wanted to raise is the fact that I am autistic. However, my autism wasn't actually diagnosed until I self-referred for an assessment at the age of 27. This was despite engaging in health systems for over a decade prior, with fairly stereotypical autism symptoms and a fairly stereotypical autistic presentation, as well as a number of medical and psychosocial conditions which are commonly co-occurring in autistic women. The key here is that I wasn't a male or I wasn't a boy at the time, and the autism was and is still not well understood in women, girls, and gender diverse people. As the national voice for women's health, all of us at the Australian Women's Health Alliance know that my experience is not mine alone, but it is representative of many women, girls, and gender diverse people who struggle to be taken seriously or to gain timely and appropriate diagnosis and care for a variety of conditions. By providing our new course, we are trying to combat this by providing professionals in health and social care, including clinicians, administrators, and policymakers, with information to incorporate a gendered lens into all of their work. The course will include 5 modules, and today we are launching the first module that you can access immediately. The course is also interactive and engaging with features such as videos, quizzes, and activities, because we know that a multimedia approach is the best way to communicate messages, especially when people, as we know, have many different learning styles and accessibility needs. In developing this module and launching it, the Alliance would like to thank the Department of Health and Aged Care and all of the people and organisations that contributed, including our expert reviewers, graphic designer, copy editor, and everyone who attended a co-development session or tested our draft materials. You can visit our website, the Women's Health Hub, where we have acknowledged some of the many people and organisations involved in shaping this course. I would also like to thank everyone for attending the webinar today and encourage each and every one of you to engage with our e-learning, and share with your healthcare providers, local members of Parliament, and broader networks. I will now pass on to Shanna, our Senior Project Officer, to give you the first tour of our course. So over to you, Shanna.
Thanks, Heidi. Hi, everyone. I'm Shanna. My pronouns are she, her, and I'm the Senior Project Officer at Australian Women's Health Alliance. So as Heidi said, I'm here to give you an overview about the course we're launching today. Now, women and gender diverse people experience health, illness, and healthcare differently to men. The Women's Health Hub, which is funded by the Australian Government Department of Health and Aged Care, is a national resource for people who want to help improve women's health outcomes. You may be involved in policy or advocacy, research, healthcare, or play a different role in your community. This course is part of the suite of prevention in practice resources that we want to make freely available and easy to access. It aims to increase understanding about these gender differences and how gender responsive approaches can improve health equity. And I think some of you who are joining us today have been involved in shaping our course one way or another, or if this is the first time you're learning about it, welcome. The Women's Health Hub and e-learning course is for workplaces with health practitioners, professionals, and policy makers across a range of sectors. So whether you're in the public sector, in government, funded health peaks or professional associations, or you work at the local hospital or primary care setting. You might work in community sector, so social and community services, non-government organizations, whether it's supporting people experiencing homelessness to domestic and family violence or allied health. We hope this is a course that you can gain something from as well. Or you might be from the business sector or private, working at a private hospital, think tanks or private health organizations, or you might run your own practice or business, work in the health and fitness industry, for instance. And also academia and education. Whether you're from a university, school, involved in health research translation, this course is available to everyone. And we also recognize that prevention not only happens through services and work, but also in the community. So learners may include individuals in the wider public, including those studying or entering the health workforce, young people, community-based advocates and lived experience practitioners, health consumers, and also leaders from community and cultural settings interested in the health and well-being of their community. So even if you don't work in a health setting or organization, you can still complete this course. Now, we started developing it after feedback from people that said there's really a need to provide resources to help workplaces and practitioners to understand just what gender responsive health is. With users at the center, this course was co-developed through many different activities over the last 12 months and engaged people from different professions, backgrounds, and geographic locations where we identified training needs, did some user experience planning, and hopefully some of you here attended some of our co-development sessions or focus groups, or even took part in our user testing. Through all of this, different themes came up, such as how do we incorporate intersectionality across health to illustrate gender differences and how they intersect with diverse lived experience, especially considering the barriers that women and gender diverse people face in getting support for their health. So we've incorporated these into scenarios, reflective questions, and suggestions in our example resources and tools. Accessibility was another aspect. So we've tried to use plain language as much as possible, mix up content to to suit different learning styles, and also having a trauma-informed lens as well, both for professionals and individuals in the process of completing the e-learning, but also ideas to help integrate that gendered approach with actions that are also trauma-informed as well. Now, I'm sure you're excited to see the course, so I am just going to take a moment to start sharing my screen. And there should also be some links in the chat very soon. I might just see if I can pop them in. If you can just bear with us 1 second. So that you can follow along as well. So welcome to the e-learning platform for the Women's Health Hub. To get started, you can fill in the form to create an account and start your learning journey. And then you can access the course, Introduction to Gender Responsive Health, in our course catalog. So we'll just get into that in a moment. Now, as Heidi mentioned, it's a self-paced course made up of 5 modules, approximately 30 to 40 minutes each, with optional resources to read, watch, and download in the future. Tonight, we are launching the first module, What's Gender Got to Do with It? Understanding Gender Responsive Health. And if you enroll, you'll be able to see as future modules are released in this section as well. So if we have a look at the course, you will see a navigation pane, which also shows the progress that you're making. And you can see, as well as been mentioned, we've tried to incorporate a mix of different activities, videos, and things that you can take with you, not just when you're doing it, but also if you're wanting to take things back to your workplace or team or community groups, you can download resources to use for future, as well as take time to reflect on different activities and different learnings. So in terms of professional development, we're really hoping that this helps connect theory with practical scenarios, provides that reflective learning space to relate to your own experience and settings, and also develop that shared language, because we know there's so much jargon that exists across health and different systems. And by having an introductory module, we hope that this can help, I guess, provide some of that shared language, depending on who you work with, who you're advocating with, or the funders that you're wanting to apply for funding for example. I'm just going to stop sharing my screen in a moment, but actually, let's see if I can show you this while we are live. As you go through as well, there'll be badges and a certificate that you'll receive when you complete all of the modules that you can add to your professional portfolio. You'll also have ongoing access to the platform as well. So if it was something that you were interested in, whether it's for a workplace induction, for new staff, for professional development days, or for volunteering, activities and things like that, you can do it on your own or in a group. And we're also looking at ways that this can count towards continuous professional development. So if you do have any questions about that, please let me know. I can put my details in the chat as well. Other ways that you can introduce this training into your workplace or community is actually by sharing this webinar to prospective workplaces or your colleagues, because we know that, trust is really important, and being able to share something that is evidence-based with people that you know, we would love for you to help spread that message as well. So on that note, I will hand it back over to Sally. And yeah, I look forward to continuing this conversation with yourselves and the panel. Over to you, Sally.
Thank you, Shenna, and that's a great overview. I've had a chance to have a look at the course, and I think it will be a really useful resource for the sector. So thank you for doing that work. It's a fabulous contribution. And now, right on time, we have a chance to have a conversation with our fabulous panellists. So I'll introduce the three panellists that we have this afternoon, and then we'll have a bit of a chat. There might be an opportunity for some questions. So if you do have questions, put them into the Q&A, and Shenna and Jana will monitor that. We may find ourselves running out of time though, because we've got so little time and so much to say, I know. So I'll launch in and first of all introduce Dr. Samara McNeil, who joins us here from Broome. She's an Aboriginal medical doctor with ancestral ties to the Nukuna people and was raised on Darawal country. She's currently training as a GP and has just finished her subspecialty training in obstetrics, gynecology and women's health. She's the chair of Violence Prevention Australia. Welcome, Samara. Thank you for joining us. Second, we have Kate May. Kate's a health promotion and communications consultant based in Melbourne. She works with public, private and not-for-profit organisations to support health promotion, research, communications and engagement projects. She's also a strong advocate for women's health, using her understanding of public health and lived experience of chronic illness to drive change. And thirdly, we have Katherine Lim. Hi, Katherine. Katherine's based in Naarm, Melbourne, and has a background in gender equality, international development, public health, online learning and creative communications. She currently works at the Equality Institute, where she has recently been leading the fabulous Finding the Joy Feminist Leadership Incubator for women of colour leading change. Lovely for you to join us, Katherine. Thank you. So first, I'd like to ask each of you, what does success look like for you? How will you know if we've landed where we need to land? What does a health system that works effectively for all genders and for everyone look like? And I might start, if I could, with you, Samara, given I introduced you first. What does success look like for you?
Thanks, Sally. I think that's a great question to start on. For me, I think it's a healthcare system where clinicians, as well as everyone working in the space, is aware of their inherent biases and so aware that they can intervene so that they don't influence their interactions with patients. I see this as something that's very proactive, focusing on education from a young age for men and women about women's health issues, as well as more of a focus on appropriate research into medical conditions and medications and how they differ in the female body. But essentially, I feel that a truly kind of gender responsive healthcare system would result in healed communities. I think that women, given the care that they need, would cause, strong self-determination and confidence when seeking healthcare, and this would result in better health for them as well as their communities.
Thank you. That's a really important answer, and I agree with you. I think that gender responsive health delivers system-wide benefits. So thank you. Kate, what's your vision of success?
Thanks, Sally. For me, an effective health system is one where services are equitably available to men, women, and gender diverse folk based on need, evidence, and kindness and care as well, really far away from stereotypes or outdated gender-based assumptions. So for me, chronic illness is my area of interest, particularly public health, and I'm interested in statistics and what's happening at that population level. We know that across the lifespan, women experience higher rates of chronic illness and more loss of healthy years of life compared to men. They face conditions unique to female anatomy, like endometriosis or reproductive conditions. They also face conditions that disproportionately affect women, like migraine or fibromyalgia, two conditions that I live with myself. And then there are also a lot of conditions that have different risk factors or symptoms or interventions based on sex or gender differences. So we know that there are sex and gender differences in health and medicine, but we have a history of basing our knowledge and treatment on men or outdated or untrue gender biases. So particularly what I'm looking at the minute is pain, and women sometimes have this stereotype of being hysterical or not taken seriously because of their pain. We know that inaccuracies mean that people don't receive the care they need. They might miss a diagnosis of a pain condition and spend more time in their life in pain. So what does success look like? It looks like improved health. And at that public health level, we'd be seeing reduced gaps between the rates of chronic illness and preventable ill health between men and women.
Succinct. Thank you. Thanks very much. Tell you what, I'm not a health specialist. I'm a gender specialist, but I cannot tell you how shocked I am at how poorly it seems the health system is engaging on gender issues. So I think this course is so much needed, and this conversation is so much needed. And I think I'm seeing it starting across Australia now, which is fabulous. Katherine, what does success look like for you?
Thanks so much, Sally, but also just want to absolutely support and echo everything that Kate and Samara have said. I agree 100%. I'll try not to overlap too much, but perhaps to add to that, to me, a successful gender responsive health system is really about leaving nobody behind. At the Equality Institute, we talk about intersectionality and what it actually takes to apply an intersectional approach in practice. And I can probably expand more on that below. But really, it's about understanding that actually the fastest way to remove barriers for everybody in a health system is to focus on those of us who are the most excluded by it first. And by centering their voices, it's actually in the process automatically removing the barriers for everybody else. So it's actually kind of the quickest, closest, most efficient way to create gender equitable health systems for everybody is to focus on the women who are most excluded by them. And again, like Samara said, taking that really positive, strengths-based and proactive approach, understanding that health is about more than the treatment of disease. It's about building a society that supports well-being. And really understanding the power that we have in this room as practitioners, as change makers, as policymakers, etc. Like really a successful health system, which has a gender responsive lens, has so much power to actually create opportunities that undo disadvantage and inequality rather than reinforcing and compounding them. And I guess also on a slightly more negative note, reinforcing the risk of not having a gender responsive lens on health. And I guess we can expand on this more perhaps in the coming panel, but just the systems and the structures that we are operating in are far from neutral. And a lot of them, through the way that they operate, are compounding and reinforcing inequality and harm. And I'm sure we'll have an opportunity to talk more about that below after this.
Thank you, Katherine. I really want to emphasise the point that you make, that a system that works for the people who are most excluded, for the people who are most disadvantaged, is going to work for everybody. And then we've got to flip the script, because at the moment it seems to be designed for the people who are most included, most privileged. It's really unfortunate. So I might go back the other way and start again with you then, Katherine. And so does our health system currently have the capacity to deliver gender responsive healthcare? What do we need to do?
100% yes. And I mean, I think it can be challenging sometimes when we open up this can of worms, because it can really seem like there's so much to do. It's, you know, it's important to acknowledge the ways that the system is currently failing, to provide this as a way to understand and create the solutions. And in that process, sometimes it can feel a bit overwhelming. And sometimes it can be easy to feel like wherever we're working from, like we're just kind of small cogs in the system and we don't have the power to really change anything. But it's absolutely achievable. And what we are drawing from is a really strong and powerful evidence base. If you've had a chance to do the course, it is really great at providing that translating role between the current evidence base and best practice and your current work to apply it wherever you are in the health system. But we know what works and we're learning more about it every day. It will take resourcing, it will take time, it will take work, but with the will and with everybody working from all angles and all levels, it is 100% possible. And, you know, one of the first steps is the one that everyone's taking tonight, is really engaging with these issues and getting curious and learning more about it. Start from where you are. You don't have to know everything, but just through taking small steps, like courses like this, engaging with alliances like this, you can learn to see from these gendered perspectives, and apply them in your day-to-day to your work in health. And really, when amplified, this can have a huge impact.
Absolutely. I mean, clearly we need investment. Clearly we need attention. Clearly we need research, and we need a lot of it. We're so far behind. But I really agree with you that our cultures and our institutions are built by the small daily behaviours of each of us, right? And we can all start now. So I think that's a really important message, Katherine. Thank you. Kate, what's your thoughts about can we change? Is there a pathway for us?
Oh, of course, there always is. And I think the way I like to reframe it or to sell it is that a gender responsive system is a more effective and efficient system. You hear a lot in the health space about capacity, or, you know, we've got a stretched system, there's too much going on, that's in the too hard basket. But I really think that's not the way to look at it, because this is a way that can open up the system. And we have to remember that systems aren't inherent, immovable objects. They're made up by people and the decisions that people make. So change is always possible. I think an example of how it can be more efficient and effective is to go back to what I was talking about before with endometriosis or chronic conditions that have really long diagnostic periods. For example, something like endometriosis can take on average of 7 years to diagnose. If we have better knowledge, skills, access to diagnostic and treatment services for women who have those debilitating symptoms like chronic pelvic pain, the diagnosis delay can reduce and women can get the treatment and tools they need to help manage their condition better. So we'd actually be opening up capacity in our health system instead of keeping women and our services and health professionals in this cycle of misdiagnosis and ineffective care that takes a toll on us all. So absolutely. And I'm excited to see more of this work unfold.
Thank you. And Samara, what are your thoughts? Can we change? Do we have the capacity to have a gender responsive health system?
I think yes and no. I think, like you said, Sally, currently our healthcare system, you know, stems from and was built by the majority, which isn't the majority anymore, but is very, you know, male focused, and it's causing failure. But as you said, Kate, I think every system does have the capacity to change. And I wonder if our current framework for our healthcare system is too paternalistic. I think in order to have more women in positions of power, and in order to get that, I think the current workforce design is just obstructive for women. And I think for true, complete gender responsive healthcare, the system needs to be based on a matriarchal framework, and that's a big shift. But I think that could have flow-on effects for healthcare workers, as well as patients and their communities. I think we just really need to be aware of, the work that women do in caring for their families and communities and all the unpaid work, and reinforcing what Katherine said, including the most excluded people in those positions of power is going to result in a more inclusive and healing space and more healing healthcare workforce.
I really agree with you. I think that the health system was developed on that Cartesian system that sees human beings as machines, right? And if you've got a broken arm or a mechanistic problem with your body, it probably works pretty well, right? But a lot more, we're seeing the systems problems that affect a lot of women. A lot of the healthcare problems that women have with chronic pain are systems problem, and that health system just does not seem to respond effectively. So I agree with you. I think there's always room for change, but it's a long path, I think. But talking about that pathway, I might start with Kate this time and ask, Kate, what do we need to do now to start us down the pathway towards a more holistic and gender-sensitive health system?
Well, good start attending a session like today and getting involved in the topic. My background wasn't at all in gender, or it's not what I studied at uni. And I think my own journey has been listening, getting involved, and now I'm obviously so captivated in it that it's a big part of my work. But I think what health services professionals, other stakeholders need to do is to be open to challenging themselves and challenging their biases, because we all have them. They're everywhere, and that's okay, but we need to relearn a better way forward. And it's okay to make mistakes and get it wrong, but talking and engaging in these conversations is something you can do now. And I do want to share one example that's I've really been enjoying watching unfold and looking forward to the future. And that's the current women's pain inquiry that's going on in Victoria by the Victorian government. I've been working a little bit in creating a submission for that. And it's a great example of listening to diverse voices of women living with pain and examining those gaps in the health system, so you can create better policies that respond to those gaps. And that's an example of what is being done and more examples like that can be done.
Absolutely. I think this is really groundbreaking work, and it is a real start of a different way of seeing things. So I thank you for raising that Victorian inquiry into chronic pain. I think that's super important. And Samara, what's your thoughts about the next steps towards the pathway towards a gender responsive and holistic health system?
I guess, echoing what Kate said, more of this. This resource and this module is so great, and it starts those conversations. We just need more people talking about the problem, sharing solutions, and being aware of their biases and exploring that. As I've said before as well, I think just having women in positions of power, particularly women with lived experience, making these, big decisions, and particularly in any space, Indigenous women with lived experience, particularly making decisions about our communities. And I think as well on, at the grassroots level, I think so much harm is done by women or by people in admin positions. And I think these are also people who need to be doing this training. The first interaction a patient has in any clinical setting is often with the admin staff. So if they're up to date with this training, I think that's going to help just people's interactions and engagement as well.
Absolutely. Can you just expand a little bit on your thoughts about a matriarchal healthcare system? Is it more than just having women in positions of leadership and women with lived experience?
Yeah, look, I think, my interpretation is less of that kind of positions of power and constantly having one person above the others. I think sharing sharing power and sharing experience, and having a more even playing field amongst hopefully more women. But just removing that kind of position of power, I think would have such a great effect with shared decision making and shared implementation, without the barriers that kind of, you know, that position of power, one person in charge can just create.
Yeah, I hear you. I call those relations, you know, dominance relations. And I mean, power is a great thing if you've got it, right? So long as you use it right. And if you use it to dominate and silence others, then of course you're not using it right. But if you use it to share and open doors for others, then it is a wonderful thing. And you're a living example of that, Samara, as a Indigenous woman doctor in the, you know, far north of Western Australia. That's a demonstration of that approach. So thank you. And Katherine, what are your thoughts about the next steps along the pathway towards success?
Thank you, Sally. Everyone on this panel is so smart. Just echoing what everybody said, 100%. In terms of what we can do, I know that we've got a really diverse sort of range of people in the room. So really just some things that people can do from wherever they are, no matter what your role in the health system. And of course, as we've touched on, like learning to apply these gendered glasses is key. Really some great places to start for me are like in really just like developing our skills for empathy. So just like wherever you are, getting really curious about the actual lived experiences that people have within the health system, in the corner that you're working in. How are they experiencing your admin staff, your care, your policy that you're developing, and things like that? Particularly the people who are frequently left out of the room. You know, just always be asking yourself the question, who's not here? And am I making assumptions about what they need and what they think and feel, or do I actually have something to back that up with? And if you don't, try and make contact, try and learn something, have some conversations, but have them with respect and a bit of humility. I know that sometimes as technical experts, you know, people who have studied for years, like often we're used to being the experts somewhat, and just really centering. So there's technical expertise, and then there's the deep wisdom and expertise of lived experience, which comes with somebody through their entire lifespan. So there's so much that you can learn if you take the space to listen. And so I would probably advise that. Echoing what Sally said, just in terms of looking at your own power and privilege, and continuing to examine the spaces that you're holding, and how you can use the power that you have for good. Understanding that this gender lens, like similar to that conversation about the admin staff, it's not just in the obvious places. It's like a pair of glasses that you would put on and look at literally all angles and levels of a health system, right? So it's not just in the patient who's seeking care. It's like, how sustainable are the roles of the carers? How is the admin being done? What are the HR policies? It's like taking that gendered and intersectional approach and literally looking at everything and being like, is this excluding people? Is it causing harm? Or is it, are we using it as an opportunity to undo that harm? And you'll be surprised at what you find and the opportunities there. And linked to that, really, anyway, I'm going to go on a rant, but really using it as an opportunity, like, I guess, and like the final point I would add is one of the conversations we have a lot with the women of color in leadership that I support is really like, often people are undecided, maybe going to your point, Samara, about whether we should continue to fight for change within the systems where we're at, or whether we should, whether we just need new systems, whether the systems are broken. I don't know the answer to that. You know, like, it's a really hard question, but taking some time to dream up things, dream up new things. I got my start, like my very first job out of uni was working with an organization called the Fred Hollows Foundation. White guy doctor, you know, say what you want about that, but like what I learned from that experience is, as a professor in medicine, Fred Hollows really took the time, A, to listen, and B, to dream about stuff that didn't exist yet. And to make a noise, to use his power and privilege as a medical professional, as someone with visibility, as someone with access to power and resources in Australia, to really shine a light on, you know, the appalling conditions in First Nations remote communities in our region, you know, and, you know, eye health, niche, right? But really, it's about equality. And so you might think that you're not at the center if you're not working, say, in women's health or whatever. But wherever you are, if you put that lens of equality on it, you can use that to amplify this conversation.
Thank you, Katherine. That's a really important point. One thing I want to ask Samara, if I could, as somebody who's working on the coal face of the health system, you know, it's one thing to say you can make a difference in the way you behave and in the empathy that you bring in, the people that you identify as not being at the table and not having a voice, and engaging more sensitively, and, you know, recognizing that we build the culture by the way we engage with people. But the system also, I mean, we ask a lot of our health professionals, right, working in a system that does not do any of that stuff. How do you navigate that, where you're trying to make a change from within, but you're working in a system that clearly rejects a lot of those principles? It doesn't operate all the time, at least on those principles.
Yeah, Sally, interesting question. You know, I've come from almost 3 years working in women's health, and that's been quite an interesting experience. You know, women's health is at the forefront. You know, we've seen some great recent advances with the endometriosis guidelines, which are new, and this, you know, new sort of questioning into pelvic pain as well, and all of these, you know, lots of things that are just becoming the forefront, essentially, which is great. Recently, having stepped into the GP world, I do see a bit more of this kind of, I guess, sexism at the forefront, unfortunately, and it is tricky. Again, there's, you know, within the healthcare, within health workforce, it's difficult already. We've got positions of power, I'm under supervisors, things like that, which make things difficult. But I think it's just questioning people, and it's like Katherine mentioned, just sort of reminding people of that empathy and that interest and that wondering why. And you know, I do see it a lot. People, the diagnoses missed, and I just try to remind people around me, you know, why is she coming in and presenting multiple times? Have we missed something? Is there something else going on here? You know, and putting it back on us, and just putting that empathy into it, because I've seen some really horrible things missed, and I've seen some long chronic diseases managed by women independently, because, you know, that diagnosis has been missed. So I think that's how I battle it. I'm new to the space, so I'm trying, but yeah, it's an interesting place to be in, and it's still a very paternalistic space to be in as well. So yeah, I think what Katherine said is just right up my alley, and what I do day to day is just think why, and have that
Absolutely.
empathy.
Thank you. So we've got a little bit of time for some questions, if people have any. While you're thinking of those, we might have time for 1 or 2 questions. But I saw in the Q&A before a question about class. It was in the context of the development of the course. But I wonder if I might ask each of you, you know, I personally think class is a really important disaggregator that we often overlook. And in the health system, it can create really, I mean, clearly it creates really different outcomes. How do you see that playing out? Do you think we overlook class too much? Whoever wants to answer, whoever might have an answer about that.
I mean, I can try. I think I agree. It's a very overlooked issue and incredibly important. I think from my perspective, looking at population level, or in my comms work, we often analyse how effective a health message is, and we might try and break it down by socioeconomic status. And the first thing is it's hard to define or measure. So when that comes across in my work, it's hard to exactly know how to respond to it. Yeah, and it also can run the risk of running into stereotypes that you might have if you're at that population level and you step back and look at a statistic, but when you're far away from what that actually means, and I'm sorry that's quite a vague answer, but I think that's how it plays out in my work, that I'm often wondering if we can do a better job with that, and wondering if the information that I get at population level or based on survey responses is actually being measured correctly, or what really is best practice in that space. So that's my reflection on that.
Shanna, yeah, Shanna? Was it Shanna? Or did someone else have any thoughts on that question?
I'm happy to pull up a few questions afterwards, but I think, Katherine, you had a thought?
I'm not sure if I've lost it. But yeah, I definitely do think that class is an important factor. And maybe just, I wonder if this is helpful context. I think if we're looking maybe through an intersectional lens, we're looking at, each of us has some like a unique little cocktail of experiences and identities, and some of them give us privilege and some of them give us disadvantage. And so potentially you could have someone who experiences a lot of disadvantage in other areas, but because of their class, they experience, they are held back. And I think it's also important to note that people are showing up in our health systems not just as, from perspective like their class or their gender or their nationality or their ethnicity or religion or anything. They're showing up as people. They're showing up as whole people who are a mix of all of these things. So really, I think it's a really important conversation to have, and just to keep broadening your perspectives on the ways that different kinds of experiences and identities can change things is really important. Change people's experiences. And going back to what Samara and Kate says, how that leads to things being missed, simply because we are not sensitive to perhaps class or gender or any other factors and how they interact together. That leads to things being missed in systems.
I really agree. And I think one of the things that we often miss is the impact of trauma and really complex life experiences on people's health. And so, we see that a lot with Indigenous communities, I think, Samara, that people suffer the health impact of colonization in their bodies, right? But it's not easily able to be diagnosed by the mechanistic health profession. Could you have any comments about how complex it is for people who are suffering that kind of intergenerational trauma, whether it's through class disadvantage or, in the colonisation experience of Indigenous folks?
Yeah. Look, I mean, just briefly on the class comment, I think we know that being a female and being from a certain postcode are two independent risk factors for cardiovascular disease, so heart attacks and strokes. And so having them combined puts you at higher risk. And that's because being female, we have different symptoms. And I think the class aspect comes into play in that, no matter how much work has been done, there's always that background, like you speak of, Sally, and that intergenerational trauma. And to go right back to the basics, we were all present in our grandmother's wombs, in our mum's ovaries. So the trauma that she went through is a part of us. And I just think that that plays such a role in how we interact with the world. And I know for lots of Indigenous people, this year is really tough with a lot of major Indigenous dates coming up, and NAIDOC Week and Reconciliation Week and things like that after the vote. So I think it's just so palpable. And again, just having that empathy and having that awareness can really change that. But I don't think it's a quick fix, obviously. But it manifests in physical disease, unfortunately.
It does. Yeah. Yeah. And sorry, Katherine, did you have some thoughts?
Oh no, Samara just covered it. I just wanted to echo that and just like add the point of just like colonization, gender inequality, all kinds of things, inequalities that we think of perhaps as social issues are actually also health issues, and hugely expensive ones in the system.
Yeah, the interrelation between bodies and minds and histories is something that we need to do a lot more thinking about, I think, as we move down that pathway towards a gender responsive and equitable health system. But Shanna, we haven't got any more questions on the Q&A, but were there any questions that came through that you'd like to just quickly brief us on before we start wrapping up?
Yeah, sure. So there were some questions that came through in the registration process. So thank you, everyone. And I guess there's a couple that I'll combine. And you've already touched on things like misdiagnosis and trauma-informed approaches on that big level of recognizing that these social issues are also health issues, and so health solutions are also needed. How can gender responsive care be embedded into our health services and become business as usual? You've all touched on this in some way, shape, or form, but I guess on a practical level, for instance, how can we encourage local health districts or local government services to make this core standard for workers, or practical actions become business as usual, or practical gender responsive actions as business as usual?
Thank you, Shanna. And we've got a question here that absolutely reflects the conversation we've been having, that it's one thing for practitioners in the system to have the empathy and to do things in a different way, but we're in a system that manages our time so closely, and we haven't often got the time to devote to a particular patient. How much support from the government have you experienced? And I might start with Samara there. Does the structures help or hinder us?
Hinder. I think working in the workforce myself, our current mandatory training is difficult to complete as it is. Recently, there's been more of a push towards doing it in our paid time, which is very helpful. But I think wholeheartedly, I think that this module should be part of our mandatory training in any healthcare system, particularly, which is a good way to sort of capture a large audience. I don't know exactly how that gets implemented or made mandatory, but there's lots of training that I've been involved in that are things that I would never reach out for by myself, and have really appreciated the training in. And I think having that be done in paid time is very, very helpful, particularly our overworked workforce. So I think that's the only way you can do it. I don't know how though. Sorry, I don't have the answer for that.
Yeah, and we are facing an under-resourced health system, of course. So it's one thing to say you need to take the time to be able to devote to the complex health issues of patients, but the system is rolling on. So I recognise that we're asking a lot of individuals with a will, I think. With that, unless there's any final thoughts, yes, I might start wrapping up. But Katherine, you have a final thought.
Sorry, I'll be very, very quick. One small practical thing that people can perhaps do is do something like a audit. In Victoria, we've got something called like a gender impact assessment, which has just been rolled out as law in the Victorian public sector. What it really does, it's a bit of like a checklist for sort of going through everything you're doing, your operations, your procurement, your policies, your interfacing with your patients, blah, blah, blah. And asking some core questions about what does that look like? You know, how what is like sort of the gender responsive, like how are we doing? And when you kind of look at that, you can sort of see some gaps and find some clear priorities for action. I'll give Shanna a link to share around to a training we did on that topic, which maybe we can share in the notes afterwards. And also just doing the course, which will give you some clear priorities in that area as well.
Thank you, Katherine. And I mean, I often say the way we're looking at gender in that very broad systemic way in this course suggests to us that, and I often say, gender is about everything and everything is about gender. So you're right, we have to look at every aspect of our health system, not just the interface with patients, but much more broadly about the way we allocate time, resources, staffing, training. And so with that, I might start wrapping up if I could. And on the training point, this course is aimed at filling that particular gap that we've been discussing. So please all register for Module 1. I think Shanna has provided the link for it. Also share that link with your workplace, university, your volunteer group in rolling out the course. It's available to everybody. As I say, I've had a look at it and I think it's a really valuable contribution. Contact Shanna at the Australian Women's Health Alliance if your workplace or community group is interested in exploring this further and in more detail. And with that, I'd like to thank the participants this evening. First of all, let me thank our Auslan interpreters, Leanne and Claire. You've done an amazing job. Thank you. And I think you've kept up with us, so that's great. Thank you so much to Heidi for giving us the opening, and to our fabulous panelists, Katherine, Kate and Samara. It's been a really rich conversation and I think given a taste of the depth to which we need to start thinking if we're going to have a gender responsive health system. So thank you so much. And to Jana, thank you for your backroom support, and of course to Shanna, who is an amazing colleague and friend and has done most of the work in pulling the course together and certainly in bringing us together this evening. So thank you, Shanna, and I hope it's the start of a really long and deep relationship with gender responsive health. I think we've got a moment in time in Australia now. There's some interesting things happening in the health system, in gender impact analysis at various jurisdictions, and I think it's up to all of us to make sure that the first steps down this pathway open more opportunities and create more opportunities to have a more gender sensitive health system that will benefit us all and be, as others have said, more efficient and effective. So thank you. Shanna, did you have any final things to share with us, or are we good? I think you've said that there's a survey that's going to come up.
So yes, any feedback will be excellent, and just ideas of how we can share this with the people that you think should be doing this course as well. So thanks everyone for coming, and please fill in the survey as well.
Thank you. With that, and without further ado, thank you all very much for your participation tonight, and thank you to my fellow panelists. I had a great conversation. I thought I learned so much from you all, and thank you for your wisdom.